This is a big one, Medicaid, and the waste of dollars that have been sent out in payments for Medicaid improperly to the wrong people, to people abusing the system or just simply errors not corrected in the systems that account for who we're paying, what we're paying them, and when they're getting the money. Let me say first, I want to acknowledge that Medicaid is a vital safety net program depended on by many low-income families and children who have no other health care options. Medicaid recipients rely on HHS to effectively supervise the Medicaid program, and so do the American taxpayers who are footing the bill with their hard-earned tax dollars. But this in no way is a criticism to take down a program that is necessary to provide needed medical help to low-income people who simply can't find it any other way. But if we want to maintain the program's integrity, we have to root out the bad actors. We have to root out the abuse and waste of taxpayer dollars. Or at some point, there simply would be a rebellion back that will undermine the necessity of this program. Most importantly, the Health and Human Services Cabinet must address the high rate of improper payments that have plagued this program from its very beginning and wasted billions of taxpayer dollars. It seems that the problem is getting worse, even though Medicaid has routinely been identified as a high risk for potential waste. Being identified as a high risk, you would think alarm bells would sound and structures would be put in place so that we could solve some of these issues and not waste these taxpayer dollars or give them to the wrong people or deny others who are qualified not receiving these. In 2015, Medicaid had the second highest improper payment rate across the entire federal government. And over the past 3 years, Medicaid's improper payment rate averaged over 10% each year. And earlier this month, the Department of Health and Human Services put out an alert that Medicaid's improper payment rate for 2016 is expected to increase to 11.5%. That's nearly double the rate of improper payments since 2013. So in just 3 years, the rate of improper payments has doubled. So instead of correcting the program, instead of moving it in the right direction toward solvency and toward proper administration, it's going in the other direction. And that means more and more taxpayer dollars are being simply thrown to the wind. Put it in the fireplace. It's gone. It's gone to the wrong people. It's improper payments, and it's a staggering, staggering number. To put a dollar figure on this 11.5% of everything that goes out in Medicaid payments, you're talking about $85.5 billion, which will be improperly put out through Medicaid in just 3 years. That's an astonishing amount. Let me repeat that. Having acknowledged that there is a serious problem with Medicaid payments and misuse of taxpayer dollars, that instead of being addressed successfully, it's put us in a situation where it's increasing dramatically. And now in 3 years period of time, $85.5 billion has been wasted. And while these $85.5 billion in improper payments were made, Medicaid enrollment continued to expand as a result of Obamacare, which means more and more Americans are relying on an increasingly fraudulent system. So we have to ask the question, why do these improper payments continue to take place? Why is it accelerating? What's happening? Well, we dug into this. One reason was, a persistent problem lies within the HHS, Health and Human Services, data systems for identifying and validating Medicaid and Medicare providers. which HHS directs states to use to help ensure that those receiving payments are actually eligible. The system itself reminds you a lot of Obamacare. Remember when they rolled out that system? I can't remember the number of billions and hundreds of billions of dollars that had to be spent to fix it when we were assured that this was ready to go, all plugged in, and it collapsed. The system collapsed. And the taxpayer then had to come and rescue it with even more hundreds of billions of dollars. So one problem here lies with the agency itself in terms of implementing the right systems. Bureaucratic mismanagement, which is so prevalent throughout the federal government, has enabled providers to obtain Medicaid payments, when they aren't even medically licensed in a state, or when they don't even practice in the United States. Payments are going to bogus people. Payments are going to people who don't even live in the United States and qualify for this. The Government Accountability Office recently examined the addresses listed by some of these providers as their primary place of practice. And it turns out that a lot of them are just simply fake addresses. Let me give you one chart which identifies the address of where Medicaid payments were going. Empty lot. There's no building. There's no place, unless somebody's got a little tent in here or something like that and says, this is my home. Payments are going to this address, and there's nothing there. Everything has been bulldozed. There is nothing there. That was determined by the government. Just one example among thousands in terms of how these Medicaid payments are being wasted. Another one listed the address, as we determined, of a fast food restaurant. I'm not going to tell you which one it is, but the fast food restaurant is receiving Medicaid payments. I don't know, maybe their food's bad, and maybe someone lives in there on a 24-hour basis, sleeps on the floor, and I guess they get a burger for breakfast, burger for lunch, burger for dinner, but just yet another example. And this had to be determined by the Accountability Office going out, not on the basis of the thousands, tens of thousands of people, maybe hundreds of thousands of people that work for HHS. You would think they would have something going on within that bureaucracy that was tracking all this information. Why does this have to go to an inspector general or go to a government accountability office and some agency outside of these agencies like HHS have to determine this kind of thing? Can't somebody figure that out? And you wonder why the public is frustrated with Washington. You wonder why the public thinks their taxpayer dollars are being misused, and obviously they are. You wonder why we're getting this backlash here in this political year. And people are fed up. They're fed up with how the government is so dysfunctional and so it operates in such a dysfunctional way. And they want change. And it looks like it's going to happen. Another problem is that criminals understand that poor oversight among the agencies gives them access to Medicaid and harm patients. And such was the case for a pediatric dental company that performed medically unnecessary procedures on children covered by Medicaid. I mean, it's bad enough that somebody just puts a false address in and receives Medicaid payments in a fraudulent way. It's outrageous. It's outrageous that professional people with doctor's degrees, many of them, are using this as a basis to receive Medicaid payments by subjecting children to procedures that are not necessary. This case was a dental company that performed medically unnecessary procedures on children covered by Medicaid. These children went through significant physical pain, such as having a baby root canal, and there's no telling how many other patients have been harmed by providers that should have been prohibited from participating in Medicaid. So yes, the $85.5 billion in improper payments is a big deal. But it's also a big deal that federal agencies are not doing their jobs and allowing billions of dollars to be squandered. HHS has the tools already at its disposal to prevent these improper payments, such as verifying the location of the physician offices and making sure providers are licensed. My colleagues and I also must remain vigilant and ensure HHS is fully utilizing its resources to crack down on improper payments and bad actors within Medicaid. We are elected. It is our responsibility to come here and make sure we're doing everything we possibly can to make these agencies cost-effective and efficient, and not some bureaucratic nightmare that we have to come down here every week and talk about how taxpayer dollars have been wasted. So initially I said our goal was $100 billion. We're way past that now. We're 200 and somewhere. And with this, we add another $85.5 billion, and our chart can't accommodate it. We thought we would end up right here. Then we ended up then we went to $200 billion. This is just within this one cycle of Congress. And now we have to add, well, we had to Velcro this thing to can't get the chart big enough we're way up here now, way up here with our chart, went way over the chart. And the grand total of wasted taxpayer dollars, $326 billion. That's not small change, Mr. President. That's hard-earned tax dollars. And think what we could do to lower our debt. Think what we could do to provide for better education, better health care research, dealing with Zika, CDC, paving roads, providing services, protecting our national security, helping our veterans. Think what we could do with $326 billion of wasted money. And this is just a fraction. So the public understands, we expose this information to them, the public. Do we blame the public for being furious with the dysfunction that exists in Washington, D.C.?